Wearable sensors are everywhere, but in the age of smartwatches, smart rings, and AI, how come it's still such a challenge to locate the sensors for your prosthetic hand? Even the most advanced prosthetic hands today tend to depend on wired electrodes for their controls. And it's very, very basic, invented in 1967, and it hasn't changed much since. So you have to find the right location on your arm and then flexion to open or extension to close. It's fairly simple. But if your patient has scarring or muscle atrophy or any unusual condition, you have an endless cycle of trial and error trying to find the right location for the sensors to actually work. With the Vulcan Myoband, we remove the hassle of all of this myosite hunting and make it quick and easy. Instead of 2 fixed points placed inside the socket, we use 3 EMG channels distributed around the arm, normally on the bicep, along with a motion sensor. This means our sensors are not affected by a perfect spot placing. We can capture signals from multiple regions and adjust to figure out where the sensor is and how it needs to adapt. So even if one area is weak or noisy, the sensor can adjust and still function perfectly for the user. This sensor band is especially suitable for patients with short residual limbs, weaker EMG signals, altered muscle anatomy after surgery, limbs with lots of scars or damaged tissues, and where there's difficulty isolating individual muscle contractions. And the result is zero myosite hunting, faster fitting, expanded patient pools, and far more accessible myoelectric hands.